Are you not feeling like yourself anymore? What if it's your testosterone? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're covering 10 warning signs that your testosterone might be genuinely low, and some of that will definitely shock you. If you guys want to learn more about how to diagnose low testosterone, what are the options if you do have low testosterone, how can you improve it, check out my downloadable free PDF about testosterone, everything you need to know, Testosterone 101, and also be on the lookout for my new course where I'm going to be telling you exactly how I counsel my patients on low testosterone and what you need to know. Now, before I get into the symptoms, you need to understand what testosterone does, because it does a lot more than most people realize. Testosterone is produced primarily in the testicles, and it operates basically like a master regulator across so many body systems. Now, early in life, when you're a boy, it drives reproductive development during puberty. It helps your voice changes, your body hair come, your growth in muscle and bone mass. But once you become an adult, it does much more than that, and it does much more than just help your sex life. It helps with energy, mood, bone strength, how sharp you are cognitively, and your body composition. It helps with your overall feeling of vigor or vitality. And when it's working properly, you're great. But when it isn't, you start feeling it in places you never realize. So after about 30 years of age, testosterone begins a slow, predictable decline, about 1% per year. Some are less, some are more, but on average 1% a year. And that's normal. And it doesn't mean that you're all gonna need testosterone as you get older. The problem happens when the decline is steeper than that. And that's when you need some support. So depending on the definition, low testosterone can be really common. Some studies rate it as high as 38% of men above the age of 45. And some populations have even higher rates. If you're obese, 50% of men have low testosterone. If you have type 2 diabetes, 40%. So it is very common, particularly in guys who have a lot of comorbid metabolic conditions. Here's the issue. When people think about low testosterone, they think about one thing: their sex life, their erections, their sex drive. But testosterone is so much more than that. And that's why I'm making this video, so you know the top 10 signs of low testosterone. Number 1, a significant persistent drop in sex drive. Absolutely, this is a sign of low testosterone. And this is not just a temporary thing, like you had a stressful project or you had a temporary dip where you weren't interested in sex but it came back. This is a sustained, unexplained change in your sexual urges. And it isn't really related to your relationship issues or other major life changes. And usually this doesn't fluctuate very much. It just quietly stays low when your testosterone is low. And the issue is most people just brush this off as getting older. That brings me to the second one, which is erectile difficulties. Testosterone doesn't directly cause erections, but it plays an important role. It activates brain receptors that trigger nitric oxide release, and that's the ignition for erections. Essentially, nitric oxide is released from nerves and blood vessels to tell your blood to flow into the penis and create an erection. But one way that you might know it's your testosterone is that you might notice your morning erections, the ones that you wake up with spontaneously, are going away. And this you can see even at higher levels of testosterone compared to what the guidelines say. So most of the guidelines, particularly the American Urological Association, uses a cutoff as 300 nanograms per deciliter as the diagnosis for low testosterone. However, morning erections start to decline on average at a number of 320 nanograms per deciliter. Number 3 is fatigue that doesn't go away no matter how much you sleep. Now, fatigue is very non-specific. It's on the list for many, many conditions. But when you have fatigue associated with a biologic problem, it's not situational. Not like, oh, I had a long week, I didn't sleep well this week. It's basically a baseline flatness. No matter how much rest you get, you feel exhausted, like you're operating at half capacity. Now, on its own, the system could be a sign of anything or nothing. But when you combine it with all the other things on this list, it's a meaningful piece of the picture. Also, you should never settle for feeling chronically exhausted. You need to investigate with your doctor about what's going on. Number 4, muscle loss that doesn't respond to training. You do lose muscle as you age, but it should respond when you go training. And testosterone plays a direct dose-dependent role in building and preserving lean muscle. When levels fall of your testosterone, the body becomes less efficient at maintaining muscle tissue, even in guys who are consistently training. And the research is pretty clear. The lower the testosterone level, the more pronounced the loss of lean muscle. So if you're still working out and you're just not seeing results, or your strength has really gone down without changing your habits, it could be a sign of low testosterone. Number 5 is mood changes. Now, mood changes can present in a number of different ways. It can be sort of a low grade, kind of constant irritability or a lack of motivation or even depression. When I see my patients who have low testosterone, they describe that they're feeling less like themselves and they can't really articulate exactly why. And men with low T are 86% more likely to suffer from depression. And studies show that when you replace testosterone, it can improve depressive symptoms by 15 to 20%. That's almost as good as taking a medication for depression. There's also sort of a cognitive component. Men will say they have brain fog, difficulty concentrating, trouble finding words in the conversation. Now, those first 5 symptoms and signs are the ones that people actually talk about. But the next 5 are ones that most people don't realize are connected to testosterone. And even more so, these are the signs and symptoms that get misdiagnosed, dismissed, or attributed to completely unrelated causes, while the actual issue with low testosterone remains untreated. Number 6 is increased fat mass. Now, you can gain fat mass for a variety of different reasons, but when your testosterone declines, you lose muscle mass, as we mentioned earlier, and your body becomes less sensitive to insulin, meaning that it's more easier to store fat. And the result is that there's a shift in how and where your body stores fat. Specifically, you see it more in the abdomen or the belly. Now, in fat, you have an enzyme called aromatase, and that takes testosterone and converts it to estrogen. So not only have you gained more weight, but now your testosterone is getting converted to estrogen, and now you create a vicious cycle. So there's less testosterone available. Number 7 is bone loss. Men who have chronically low testosterone have significant reductions in bone mineral density. They're 50% more likely to break a bone and triple the odds of getting osteoporosis in their hip or rapid hip bone loss. Now, hip fractures are serious because in elderly men, once you have a hip fracture, within 1 year, the mortality rate is 31%, meaning you get a hip fracture because your testosterone is low, you could die within a year. 3 out of 10 guys, nearly 1 in 3, will die from that hip fracture. Number 8, your body and facial hair are thinning. Now, I want to be careful here because the relationship between testosterone and hair is very complex. So the potent converted form of testosterone is dihydrotestosterone. So testosterone converts to estradiol, which we talked about, and dihydrotestosterone. And dihydrotestosterone is associated with scalp hair loss in men who are genetically susceptible. But body hair and facial hair are different. When testosterone levels are low, hair in these areas becomes sparser, it grows slower and patchier. You might notice less underarm hair, your beard is thinning, less chest hair. Those can all be signs that testosterone might be low. Number 9, you're experiencing hot flashes or night sweats. Most people think of hot flashes, they think of menopause in women, but men also can experience hot flashes, and it's often a sign of very low testosterone. In fact, when we give guys with prostate cancer medication to lower their testosterone, they often get hot flashes. And what this feels like is a wave of heat that spreads across your chest, your neck, and your face. Sometimes it's followed by sweating and sometimes chills. These can happen during the day or wake you up at night drenched in sweat. And this can occur with any sort of severe testosterone deficiency. So if you're having hot flashes and you can't explain it, please don't ignore it. Go see your doctor. And number 10, you're noticing breast enlargement or tenderness. And this one catches guys off guard because when testosterone levels drop, the balance between how much testosterone testosterone versus estrogen are in the male body shifts. Men usually produce small amounts of estrogen. Estrogen is very important, so we don't want to drop it down very low. But when testosterone falls, estrogen can become more prominent in how it affects the body. So men can get what we call gynecomastia, or man boobs, or they'll just feel like tenderness and sensitivity in the chest. Some guys even notice a sort of firm rubbery disc of tissue that is behind the nipple. Number 11, you have unexplained anemia. Now, anemia is a low blood count. And this one, most guys don't realize that they're linked. And even the physicians that are treating guys don't always notice that this happens. Testosterone actively stimulates red blood cell production. So when testosterone drops, you can have a mild anemia, meaning a drop in the production of red blood cells. And this can produce symptoms like dizziness, disrupted sleep, fatigue, and sometimes irregular heart rate. And this anemia often goes unexplained for months or years until someone thinks to check the testosterone levels. Now, in clinical trials, men who have confirmed testosterone deficiency and anemia who got testosterone replacement showed significant improvements in blood counts compared to those who didn't get the testosterone replacement. So if you've been told that your blood count is low and there's no real clear etiology, make sure you get your testosterone checked. If you recognize 3 or more of the signs or symptoms I described today, I want you to make an appointment with your doctor and specifically ask for 2 early morning testosterone tests. You need to do 2 because there's so much variation between your individual testosterone results, and you need 2 to make sure that it is indeed low. If the first test shows a low testosterone, then you absolutely want to get a second test along with a few other tests. You want to get an SHBG, or sex hormone binding globulin, to calculate your free testosterone. And you also want to check other hormones that might be affecting testosterone production. These include TSH, or your thyroid stimulating hormone, prolactin, estradiol, and LH and FSH. And remember, guys, to check out that free testosterone guide below so you can refer back to it anytime you might have questions about testosterone. If you found this video helpful, it helped clarify something you've been wondering about, make sure to share it with someone who might benefit. And subscribe. Make sure you're here every week to see new sexual health and urological education that's based in science. And as always, remember to take care of yourself because you're worth it.